Welcome back, family, to the Doctor Next Door podcast. I'm your host, Dr. George Korede. I have a really special guest with us today, Dr. Ufondu. He is a board-certified cardiologist. He spends his whole day working up people that have heart disease, diagnosing them, and helping them have better health. Welcome to the show, Dr. Ufondu.
Absolutely. Thank you so much, man. Thanks for having me on the pod. You've told me about this in the past, and it's an honor to step on and chat a little bit with you.
Man, thank you for taking time and blessing the podcast. We love having specialists come and teach the audience the nuances to make ourselves healthier. So we'll jump in. Whenever I start, I always ask the specialists what drew them to their field of study. So, you're in med school or even before med school, perhaps in college. What was the thing or patient or life experience you had that made you say, you know what, I really want to work on people's hearts?
Man, that's an interesting question. The funny thing is, when I was in high school, I did not like the sciences at all.
Okay.
It's funny, when I got into college, I was talking to some of my friends way back from high school, and I told them, "Hey, you know what? I'm thinking about going to medical school." They kind of chuckled at me. Wait, are you the same guy we knew back when?
Right.
But no, when I was in college, I really liked economics initially. And
Okay.
then at some point, the flip switched. And then I started leaning towards the sciences and eventually decided to go to medical school. And as you know, when we get into our third year of medical school, that's where the floodgates open up, where you have, a lot of options. Are you going to
Sure.
be a surgeon? You want to do internal medicine, psychiatry,
Sure.
so on and so forth. And
Yeah.
so, I went into my third year with an open mind. Ultimately, my second rotation was internal medicine.
Okay.
And then, I got through my internal medicine rotation. I knew it. I knew exactly what I wanted to do. I was happy. I was done. So then
Sure.
I went through my surgery rotations. I went through my OBGYN rotations. I went through everything else, knowing that ultimately I was going to come back to internal medicine. Ultimately, I got into my cardiology rotation, and that same switch that flipped when I went into internal medicine flipped again.
Okay.
The impact that I felt that I could have with cardiology, going through the rotations, I would see my mentors at the time in the morning deal with emergencies, and in the afternoon go to clinic and have a certain level of impact as well. And
hmm
that's the kind of thing that I felt like I wanted to do.
Yeah.
And here we have it. Here I am.
Yeah, man. Yeah. I mean, I definitely think anyone that has the opportunity to shadow a cardiologist or see a heart surgery or get in a cath lab and see somebody urgently have their vessels reopened, you know what I mean?
Well,
Is a very rewarding It's scary, obviously, it's critical. I don't want to make light of that, but I think it's one of the most phenomenal advances in technology we have, and it saves lives. So it's very rewarding.
absolutely. I think you hit the nail on the head with the word rewarding. The thing about cardiology is we have a lot of tools in our tool belt.
Mhm.
The technology has come a long way. There's a lot of things that we can do to help patients who are in trouble. There's also a lot of things that we can do to help prevent disease, which is actually one
Mhm.
of my passions, is preventing disease
Sure.
before they become the ugly head.
So let's jump into it. I mean, you hit it on the head. That's what it's all about. That's what the Doctor Next Door is all about: preventing and making changes, right? So we'll start just broadly with heart health. Why is it such a big deal? Why should we care about our hearts here in America and the Western world?
The thing is, in America, heart disease is the number one killer for adults. And the sad part is there's a lot that we can do on the front end to avoid these things. And very often, they're not very difficult things to do. We just need to create awareness.
Sure.
A few things that I like to mention are I think it's critical for adults to know their numbers.
Okay.
Know what your blood pressure runs. Know what your cholesterol is looking like. Know what your blood sugar is looking like. Try to sleep well, try to eat well, try to
Mm.
exercise. These things, I think over a long run will help prevent some of the catastrophic events that could befall people who don't care about these things. So
Sure.
I think they're pretty simple things to do. It's
Yeah.
just a matter of being consistent with those things.
Yeah. Well said. So you said something. I always like being practical because we're docs, and I don't like feeling like we're talking over them and stuff like that. So you mentioned blood pressure, you mentioned cholesterol, you mentioned your blood sugar. So should this be something they should be asking their PCPs for when they go for visits? Is this something, hey, I should be checking my own blood pressure if I'm capable, or I can get a free check? How do you propose people kind of take hold of that?
Something I encourage, particularly young people. who think they're indestructible is, make it a point that every year around your birthday, you make an appointment with your PCP. You know your birthday's coming up. Something should go up in your head. Hey, I'm gonna have a good time on my birthday, but either before or afterwards, I'm gonna also see my PCP.
Yeah.
You get plugged in with your PCP. Most of the time, your PCP can handle a lot of these problems. They can make sure your blood pressure is on the check. They can actually also teach you how to check your blood pressure the right way. They
Yeah.
can make sure your cholesterol is under control, and if it's not, there are things that we can do to help get that under control. Make sure your
Yeah.
diabetes, if you do have that, is under control, or try to prevent it from being out of hand.
Yeah.
And then one other thing I like to mention before we move any further is one problem that goes undiagnosed or underdiagnosed over a long run is sleep apnea.
Okay.
A lot of people think that sleep apnea is for older adults or morbidly obese patients,
Huh.
but that's not usually the case.
Yeah.
More and more often we find undiagnosed sleep apnea in patients who have normal body habitus. They're not obese, but this just because of the anatomy, just the way the neck is structured, they have sleep apnea. And because of that, they don't sleep well. Because of
Interesting.
that, they have unchecked hypertension. They've got diabetes. They're sleepy during the course of the day. And
Mhm.
that's just to mention a few. There's a lot of other things that undiagnosed sleep apnea can do that, if we can get that under control early on,
Yeah.
it can really impact patients positively.
I mean, I think that's well said. There's a lot that you kind of touched on there. High blood pressure, high cholesterol, diabetes. Those are entry points or data points you can follow up each year with your doctor. Even if you're young or feel you're invincible, right? You still need to go and get these things checked because you're alluding to that these are risk factors and could contribute to you having a heart attack, right? Or having a heart disease, right? And could you kind of touch on the relationship with cholesterol and blood pressure and sleep apnea and you know so the people that have that, they're certainly at increased risk for heart disease. But can you kind of press upon them why that's so important? I mean, okay, so I've got sleep apnea. Well, so what, doc? Who cares, right?
Well, let's start off with sleep apnea. Without going too deep into the
Sure.
physiology, what happens is, if you've got obstructive sleep apnea, when you go to sleep, you're not taking enough oxygen. And what that does is it creates an enormous amount of pressure on your heart. So
Okay.
so what it does is it causes something called hypoxemia. That hypoxemia, all that means is your body is not taking enough oxygen into the body.
Okay.
And what that does is, because of that, the way the body responds is it tightens up your pulmonary arteries, your pulmonary vessels. And so, what I'd like for you to imagine is your heart is a pump, and your pump is trying to pump against a really tight pipe, a really close pipe. It
Mm-hmm.
puts an enormous amount of pressure on that pump, and if it does that for a long time, it might fail.
Mm,
So, if as you can imagine, that harkens towards heart failure. It could do
sure.
that. It's not
Yeah.
uncommon.
Right.
So, the simple treatment for obstructive sleep apnea, the first one would be try to lose weight. Sometimes, despite people's best efforts at losing weight, they've lost weight, but despite that, they still have sleep apnea. And those patients, we recommend using a CPAP. That's just continuous positive airway pressure that keeps those vessels open. That way, your
Yeah.
heart does not pump against a tight pipe. That's number one. Other is, let's go back to high blood pressure. If high blood pressure goes unchecked, it could cause an enormous amount of damage. Number one, it could lead to heart attacks. It could lead to strokes. It could
Mm,
lead to heart failure. These are things that we don't want to happen. One of my favorite sayings is prevention is better than cure. It's
mm,
better to prevent these things in the front end than have to deal with the sequelae in the back end.
yeah.
And so, like I said, there's little steps that we can take,
Yeah.
and I imagine we'll go into a little bit more detail as we move on. There's little
Sure.
steps
Sure.
we can take to prevent some of these things from causing a lot of problems down the road.
Absolutely. That's really good, Dr. Fondo. I mean, invincibility of young professionals, right? You've hit on that. You're talking about high blood pressure, know your numbers. You're talking about cholesterol, get that checked. You're talking about diabetes. And then I think that's a fourth free one you gave people because I don't think people really talk about obstructive sleep apnea or see the link between that and heart disease and heart attacks and strokes. So I think that's well said. Thank you. So you
Absolutely.
you already alluded to it. You said there's certain things we can do. There's steps we can take to improve our risk for heart disease, heart attacks, and strokes. You talked about sleep a little bit. You talked about being overweight. Can you give us a few pointers? What are 2 or 3 things we should all be leaning into to try to prevent heart disease?
The first thing I would say is move. Try to move your body. What I recommend to my patients is try to get at least 150 minutes of moderate intensity exercise a week. So what does that break down into? 30 minutes of brisk walking a day for 5 days a week. I think that's doable.
Yeah.
We're not asking people to all of a sudden become marathon runners in the twinkle of an eye overnight.
Yeah. Yeah.
But a little, just move your body. That goes a long way with controlling what we call cardiometabolic syndrome, which is just a fancy way to talk about hypertension, diabetes, kidney disease, and high cholesterol. The second thing is eat well. Try to eat a balanced, nutritious diet. In this economy, it's very challenging for people to grocery shop properly. After they work a long shift at work, they tend to lean towards fast food. But if you can take some time, what I try to recommend to my patients is you may not have time during the course of the week, but you can meal prep, at the front end of the week. That way you're not thinking about what you're going to eat on the Tuesday night after a long shift at work. Come back home and you have a nutritious meal waiting for you, because we all know we don't make the best decisions when we're tired after a long day of work.
Hey, Dr. Korede comes home. It's been a rough day. Anything can get eaten. You never know.
Anything is possible when you come back from that happens to the best of us. So,
Right.
the best what I usually recommend is try to avoid those temptations when you can in the front end. So
Yeah, very good. So meal prep, moving. So you talked about diet a little bit. Can you speak on medications a little bit and supplements? I know we live in a weird world right now since COVID. Everybody's their own doctor and they can research it on ChatGPT. And well, I don't take statins anymore because that podcast bro told me not to, right? So could you take a moment? I'm glad I could make you laugh with that as a fellow doc, but could you take a moment and just speak on statins in general? I know there's a lot of science. We won't have to get into all that because I don't want to overwhelm our listeners today, but who are statins for? And just briefly, what do they do on a very elementary level so all of us can understand?
So, there's been a lot of controversy around statins in the past. But I'd like to inform your viewers that there have been a lot of studies. Statins, there's no evidence that statin cause dementia. I think that's one of the things people are most afraid of is down the
Hmm.
line, I might start to be a little bit more forgetful than I'd like to be.
Sure.
There's no concrete studies out there that statins cause dementia. Statins work. They do work in controlling cholesterol. They work by what we call stabilizing plaque. So in patients who've had an event, heart attack, stroke, or severe peripheral artery disease, something like that, I try to tell them, hey, I don't think you have much of a choice. You've had an event. Let's try not to have that event again.
Because your risk is higher. I mean, once you've had that, it's much higher that it's going to happen again, or it'd be more catastrophic.
Absolutely. We know that it can happen to you. Let's try to avoid it from happening again. The second thing is, recently, I think it was earlier this year or late last year, we had an updated lipid guidelines. And all in
And
all,
and lipids for our listeners are just a measure of your cholesterol in your body. But go ahead.
absolutely. The take home message from those guidelines was we need to be more aggressive with controlling cholesterol, not just in patients who've had an event, but in younger patients. We need to screen these people earlier and get their cholesterol under control. That way we can prevent events in the future. So what I tell my patients is, listen, I'm going to give you 3 months to fix your cholesterol. We're going to work on your diet. We're going to work on exercise. We're going to do all the things that we can without introducing medicines.
Right.
Once we give our best shot at controlling the cholesterol without medicines, at that point you'd have declared yourself. And the thing is, sometimes uncontrolled cholesterol is through no fault of your own.
Yeah.
It's just the way you're born. Sometimes you're just genetically prone to having uncontrolled cholesterol. And so despite all the treadmill exercises or push-ups you might do, or miles you might run, or laps you might swim at the YMCA, despite all of that, your cholesterol might still be through the roof. And
Yeah.
everybody needs a helping hand, is what I
Yeah.
tell my patients. Sometimes we all need a helping hand. And, so I think a lot of people, more than we know, would benefit from cholesterol medication.
So, I mean, a lot to unpack there. You outlined that there's great evidence that statins help people, especially when you're at higher risk for heart disease. I would take this moment, I would be remiss if I didn't say, everyone talk to your own doctor. This is general health information. This is not personalized medical advice, right? Everybody's case is different, but you should talk to your own doctor and come to that conclusion. But we're just simply saying that statins have been proven to be very beneficial in individuals with high risk for heart disease. And then could you briefly touch on, because this is with my patients as well, yes, some people do have side effects, right? There's a small percentage of people that may have a side effect to a statin. And I don't think that means all statins are bad or nobody should ever take them. When you weigh the risk of having a severe heart issue, could you just touch briefly on, statins? And certainly, I mean, we know
Absolutely.
that certain people unfortunately will have a side effect.
Absolutely. And this is something we deal with on a day-to-day basis. The most common side effects associated with statins is what we call myalgias. You've got muscle aches in your big muscle groups, your thighs, your legs, your shoulders. You just ache. And that's real. Particularly in patients who, like I said before, who've had an event, there are ways around this. One way is rather than, well, one, we try to scale back on the dose. Rather than being on a full dose high intensity statin, we might scale back to a moderate or even low dose intensity statin and see how they tolerate that. Some
Sure.
people, despite that measure, they still have these aches. Okay,
Yeah.
so then we say, why don't you stay on that low dose, but rather than taking it every day, why don't you take it every other day or 3 times a week? Because we
Okay.
know that any amount of statin is better than no statin.
Yeah.
Okay. So, and, sometimes despite that, they continue to have symptoms. They're giving it the best shot,
Sure.
but they all cannot tolerate it.
Yeah.
A supplement that I recommend is CoQ10. There's been a lot of evidence to suggest that patients who take CoQ10, in addition to statins, have less side effects when it comes to myalgias.
Okay.
And some patients are willing to try that. And, a lot of people get benefit from that. And some people still do not, despite trying all that.
Okay.
And in that situation, we know that we've given it our best shot. There's other medicines that we can try then that don't have those same side effects, but may not be as potent. The next medicine that we use is something called ezetimibe. It's not as potent as statins, but they don't have those side effects.
Okay.
Problem is, like I said, sometimes those medicines they're not as potent, and so they may not improve the cholesterol level like we'd like to see because
They're not as effective.
we've got a goal that we've got to hit. We've got a number that we've got to hit, especially if
Yeah.
you have an event. It's a hard number. We've got to hit. In fact, as low as possible, but it's a hard number we've got to hit.
Yeah.
That ezetimibe medicine may not get you there because you're not on a high enough intensity statin. And despite all those measures, there's other classes of medicines that we can use that we know will get those numbers to where they need. So I say that to say that just because you have myalgias or muscle aches or side effects from statins, don't give up. Don't
Yeah.
despair. There's a lot of things. Talk to your doctor. There's a lot of things that we can do to get
Yeah.
your numbers to where they need to be.
Very good. So other alternatives, reducing doses, alternate day dosing, there's different things they can do. And the idea that some people are genetically predisposed, right? Even if you did everything right, some people will have a higher cholesterol or a greater risk of heart disease, and talk to your doctor and find a creative way to address it in a healthy manner. Very good. So let's go a little to the extreme just to hammer in, heart disease is the number one killer in America, in the world, right? I mean, it kills people every day. And a lot of times, this can be precipitated with a heart attack, right? You start having heart symptoms. What kind of heart symptoms should not be ignored? What are some things that should be red flags? Hey, I'm going through life. I'm invincible. I'm only 41 in quotes, right? And unfortunately, I have some symptoms. What are the symptoms that, hey, you need to go get checked out? That could be something that could lead to heart disease or a heart attack.
Yeah, that's a fantastic question. I think that's something we need to create more awareness about. So the classic symptoms are a chest pain that's often described as a tightness in your chest, sometimes a
Mhm.
squeeze type sensation, and sometimes it radiates towards the arm or radiates towards the jaw. But
Mhm.
that's not, and sometimes they say, it lasts for about a few minutes, or sometimes it just comes and goes. That's not to say that everybody presents the same way. If you've
Okay.
got chest pain that's concerning to you, you should find your way to the nearest emergency room or call 911.
Okay.
Other thing is in women, particularly women and in patients with diabetes, they tend to present with weird symptoms. So if you've
Okay.
got something that just doesn't sit right with you, please seek help immediately.
Okay. So there's a lot of different symptoms that's not relenting, and certain people will have atypical symptoms, right? So women and certain people. So if you're having these symptoms, don't dismiss them, right? Go
Right.
get it checked out. It's always better to go and get evaluated, right? Very good.
Because another thing I say is time is muscle. The
Mm,
quicker we can solve that problem, the better chance you have of a better recovery. So
yeah.
if you wait for hours or days, your prognosis might be a little worse. Will
Mm,
actually will certainly be worse than if
yeah.
you'd gone to seek help as soon as you started to feel those symptoms.
That's a great point. I mean, you talked earlier about prevention is better than the cure. You addressing it right away is nine times, even if it ends up being nothing, it's still better than what if, right? What if? So you
Gotta
definitely want
know.
to get that checked out. Yeah. All right. So switching gears just a little bit, there's a lot of talk about GLP-1s right now. I'm just going to ask you briefly, what would be your quick insert about GLP-1s and how they affect heart, and is there any benefit and things like that? Obviously, we're not suggesting everyone should hop on GLP-1s. That's not what this is about. But could you just briefly tell us, the exciting or interesting stuff coming out with GLP-1s and heart health?
Yeah, so first and foremost, certainly talk to your doctor about, if
Yeah,
you want to get on a GLP-1,
sure.
it'd be a good idea to talk to your doctor about that. Secondly,
Yeah.
I'm a big proponent of those medicines. I think they help patients a lot. A lot of the patients that I see who have had heart attack, a stroke, or who have severe disease in their preferred peripheral arteries, they've got blockages in their legs, they've got blockages in the arteries in their necks. We know, even in the absence of diabetes, that these medicines help these patients.
Okay.
Medicines over the course of years and years, the studies are pointing towards reducing mortality and reducing hospitalization. And so I'm a big proponent of those medicines.
Yeah.
We also
Yeah.
know that some specific classes or groups of those GLP-1 medicines help people with obstructive sleep apnea. We
Mm,
know that they help a lot with those, even in the absence of diabetes. So
yeah.
in patients who've got what we call cardiometabolic syndrome, they've got uncontrolled hypertension, uncontrolled diabetes, they've got cholesterol, they've got kidney disease. These patients tend to benefit a lot from these GLP-1s. Obviously, the reason why I say talk to your doctor before beginning some of those medicines is because there are some contraindications. There's some
Hmm.
strict contraindications in whom these medicines may cause harm. So
Yeah.
please, before starting these medicines, to your doctor.
Always talk to your doctor because there are some sets of people it may not work for you. You may not be a good candidate for these medications, but yeah, there is some benefit in certain people that have been screened appropriately. Very good. So I'm gonna put you on the spot a little bit, Dr. Ufondu. Dr. Ufondu is my friend, so he'll probably beat me up after this. So tell us about tell us about your daily routine. Obviously, you're not perfect. You're human like all the rest of us, but as someone who understands the heart deeply, right, and our risk for heart disease, tell us about your sleep regimen, your exercise regimen. What does a daily meal plan look like for Dr. Ufondu? He meal preps, right? Told us how to meal prep. So tell us what are some good things you would get into in terms of diet and exercise and sleep and things like that to optimize your overall health? Do you take any supplements? Whatever you want to share to the audience, they'd love to hear it.
Well, I take a daily multivitamin. I
Okay.
do. In the past, I was not sold on that. To be honest with you, I've always been of the opinion that if you can eat well, you should be able
Hmm.
to get most of your vitamins. But what
Sure.
happens is we tend to, particularly in our profession, we tend to spend a lot of time indoors, and so some of the vitamin D's might be off, and so I think
Hmm.
I just started in the recent past taking multivitamins.
Okay.
Aside from that, I try to prioritize going to the gym. I know it's a little challenging for me sometimes. You work long hours and so on and so forth. But the way I look at it is, I've got to pay myself.
Hmm.
Okay, I've worked hard over the course of the day, but when I come back home, before anything else, I don't sit down. I don't watch TV.
Don't trick yourself.
I don't,
Just go.
because I've tried that before and I know
Yeah.
that's not for me. So as soon as I
Yep.
come home, I change, I go to the
Yep.
gym.
Yeah.
I try not to spend more than an hour in the gym.
Yeah.
Okay. So what I'm trying to say is I try to be efficient while I'm there.
Yeah.
So yeah, some days are a struggle and some days are better than others. But
Sure.
the way I look at it is anything is better than nothing.
Yeah.
Anything is better than coming home and sitting down on the sofa and watching TV.
Yeah.
I go to the gym, there's a TV there, so
Yeah.
I can,
Yeah. Yeah. There's no excuse. There's no excuse.
I
Yeah.
can
Many people have fallen victim to the I'm going to go home and sit down for a second and never made it out. Right. That's right.
I'm one of those victims, and
That's right.
I've learned the hard way that does not work for me.
Don't do it.
So
Yeah.
just come back home and I go.
Yeah.
And the other thing I like to do is I'm not a runner by any means. I don't run. I
Sure.
just have never
Not into
enjoyed.
it. Yep.
I walk.
Okay.
When I feel like it, I walk on a treadmill, run incline. If not, I just walk outside and try to get some sunshine and look
Yeah.
around and
Yeah.
say hello to people
Yeah.
and come home. And I just feel that invigorates me. It
Yeah.
energizes when I come home.
Yeah. Yeah.
Once the diet, I try to prioritize protein.
Okay.
Eat a lot of fish. I eat chicken. I eat Greek yogurt.
Yeah.
I eat cottage cheese, low fat cottage cheese.
Yeah.
I try to minimize my carbs.
Okay.
They're necessary for energy. That is true, but I'm particular about what kind of carbs I take in. I like
Yeah.
oats a lot.
Yeah. Yeah.
I like sweet potatoes, and I
Yeah.
try to take in a lot of vegetables.
Yeah. Yeah.
But I will say that you're right. So you alluded to it earlier. I do meal prep. I do that.
Yeah.
But on the weekends, particularly maybe on a Friday night or a Saturday night, I go
Yeah.
out and try
Hey.
at the restaurants around town.
Sure. Sure. Yeah. Yeah. Yeah.
You
Hey,
can't
even the heart doctor has to eat something good on the weekend. Sometimes. Sometimes. Yeah.
absolutely. It's one of my
Yeah.
favorite pastimes. So I've checked out almost every restaurant in my city. So
Very
yeah,
good.
recommendations, just let me know. That's one of my favorite things to do. So, but
Yeah.
the
Yeah.
thing is, in moderation. You just
Yeah.
can't do it all the time.
Yeah.
Otherwise, things may not look so good for me. And I try to sleep. It's tough. I think that's one thing I can improve upon is
Yeah.
trying to get at least 7 to 8 hours of sleep. It's tough to do that, to be
Oh
honest
yeah.
with you.
Yeah.
But I know that that's one goal that I think I can improve on is trying to
Yeah.
get enough sleep, because
Excellent.
like I said, we exercise, and when your body regenerates is when you sleep,
That's right.
and your mind regenerates that way, and I think that's my goal.
Yeah, yeah. No, I think that's beautiful, man. I like Ask the Specialist because people feel like it humanizes you guys and we can relate. Like, okay, if he, goes to the gym right after work, right? So he doesn't fall victim, right? If he has to meal prep, so he doesn't left to his own devices, he may end up at some restaurant not making wise decisions, right? If he struggles to get 8 or 9 hours of sleep, hey, we're all human in this thing together, but he's trying to adhere to this lifestyle. So, if on the weekend you go to that restaurant, you've made so many good, healthy investments during the week that it's not going to set you down the wrong path. You know what I mean? So I think that was well said. So
How about
what's one thing?
how about you,
Sorry.
doctor?
Oh man. Oh
You're
man. I'm the host. You can't.
trying to tables on you, man.
So, I have not shared this with my listeners, so this is actually kind of funny. So I was pescatarian for up until this year, basically. For 4 years until this year, I was a pescatarian. I recently just started eating chicken again. And yeah, I unfortunately, my father had a lot of health issues as a young man while I was learning about becoming a doctor and learning about medicine. And it really jarred me when my dad had his first stroke and heart attack. He had a stroke and heart attack at the same time. And I happened to be on my cardiology rotation when this happened, Dr. Ufondu. What's the chance? The universe, God wanted me to see this, right? So unfortunately, that jarred me so bad, or fortunate, I should say, I changed my diet. I mean, I was in my 20s and I basically stopped eating red meat and pork, right? I started learning about the association of those things with increased risk of heart disease and things like that. So I stopped eating that. I continued to eat chicken, but up until I think about 2021 to 2025, I tried to go without chicken because I just wanted to see if I could do it. I love fish like you. I eat a lot of salmon and things like that. And what happened for me is I don't know, you mentioned protein earlier. I am a naturally thinner guy anyways, genetics, whatever, even if I try to be unhealthy, I still don't, I typically get a hold of it before it gets out of control. You know what I mean? But I noticed that because I like to exercise, that I was losing muscle mass, right? Because I wasn't eating enough protein. So I'm not advising anybody else to do this, but I noticed for me, a pescatarian diet didn't give me enough protein, or it was very hard for me to come by enough protein to maintain my muscle mass, right? I became really weak in exercises that I used to be able to do very easily. And I noticed my muscle mass shrinking. So anyways, long story short, that encouraged me to restart eating chicken. I still probably telling myself a little bit, don't try to overindulge in things like fried chicken and stuff like that. Like you on the weekend, I was just at a July 4th thing. Yes, I did have some fried chicken. Dr. Korede's guilty too. I ate it. I tore it up. I did, guys. I'll be honest with you. But most of the time, I eat a lot of fish and leaner proteins because I find that makes me feel good and energized, and it doesn't weigh me down. So that's my quick diet spiel. I, like you, try to do at least 30 minutes a day. I find it very hard. I have two little kids, for those listening, so I find it very hard to do anything once I get back to the house. So I try to do a lot of stairs at work. I do a lot of squats and push-ups and things like that. A lot of those type of exercises because I don't want to. If I have to go to the gym, I'll find an excuse not to go. Right? If I, things like that. I'm in my study right now recording this, and I have workout equipment over here to the right. You guys can't see it, but I'm in here. I got 30 minutes, or before the kids and my wife wake up, I'll just go ahead and knock out 20, 30 minutes. Like that's kind of my way I've done it. And then on Saturday, I have a young man that thinks he's my friend that I work out with, and he just makes me do all these crazy workouts and makes me feel really old. So
That's great.
so during the week, I try to get, as you mentioned, at 150 minutes, I just try to aggregate and know that, hey, let me get about 30 minutes, whether it's walking, whether it's taking the stairs instead of the elevator, and subconsciously make that a part of my routine. Yeah.
That's good, man. It's a good routine to have.
Thank you. Thank you. Dr. Ufondu got me to answer a question on my own podcast. Look at that.
It's a talent.
So what's one thing you wish every patient knew before seeing a cardiologist, right? What is something that would help them on their journey if they knew before they saw the heart doctor? I mean, you've touched on a lot already, but is there anything as someone who sees heart patients each day that would be helpful?
Man, that's a really good question. I think a couple things. The importance of knowing your numbers. Knowledge is power. Some people walk around with blood pressure that is through the roof for months and months and months and are unaware of how deleterious that could be in the long term.
Yeah.
Some people walk around with cholesterol numbers that are just wildly uncontrolled for years and years, and they're just unaware of how much stuff is building up in their coronary, in their heart arteries, or in their brain's arteries, in the brains, or the arteries in their necks. So I think it's critical that you should know your numbers and understand how to control it. That's number one. The second thing is some people just don't understand how powerful movement is. An object in motion tends to stay in motion, whereas an object at rest tends to be at rest. So what I try to encourage people is just start. Just start. Do something today.
Yeah.
And tomorrow, try to do at least what you did yesterday, or if you can, just try to better it a little.
Sure.
As I mentioned before, you don't all have to be bodybuilders on the first day or marathon runners on the second day. Baby steps help. So know your numbers, try to move your body, and finally try to eat well.
Yeah.
Those things will prevent a lot of harm down the road, more harm than you can imagine.
Yeah.
The last thing that most physicians want to do is put people on medicines. If we can avoid medicines, we would most certainly prefer to do that. But, what we find is, unfortunately, we may have gotten to a point where it's unavoidable.
Yeah.
And what I'm saying is, most of the time, the use of medicines can be avoided if we can try to do the little things and do them consistently.
Absolutely. Absolutely. Just because I like to give everybody a takeaway at the end of the episode, would you say scheduling that once a year follow up with your doctor, making sure you know your cholesterol number, you know your blood pressure medicine, blood pressure numbers, cold, your diabetes number, or your risk for that. Would you say that would be a takeaway that everybody should have? I mean, that's probably pretty imperative, so that when you walk in there, you know those numbers, you know where your risk is.
Absolutely. The takeaway is schedule that visit with your primary care doctor on your birthday month. And secondly, heart disease is not just for older people. We're now catching heart disease, people having heart attacks, full-blown heart attacks in their 30s. So do not ignore symptoms. Know your numbers. Try to act accordingly and see a PCP on your birthday month.
Very good. Very good. Any bonus question? Sorry. The smartwatches and the at-home blood pressure cuffs and stuff like that, or checking any advice on that kind of stuff for the average listener?
Yeah. So there's a certain condition called atrial fibrillation. It's perhaps the most common abnormal rhythm in America, is where the top chamber of your heart is just going haywire and it's going really fast and uncoordinated.
Sure.
And that rhythm can put people at risk for stroke. These smart watches, particularly, I can speak for the Apple Watch because I know that there have been studies on the Apple Watch. They're pretty good at detecting atrial fibrillation. So, in my patients who have AFib or who have abnormal rhythms and they have Apple Watches and they say, hey, my Apple Watch told me that I've got atrial fibrillation, I pay attention to that. I don't just brush that off because they're usually accurate.
Yeah.
That's number one. Number two, there's another device called a cardio device. Some patients come in and tell me, hey, we've got this, I just got this weird sensation in my chest. It's a fluttering sensation in my chest.
Mm-hmm.
And this device, a relatively cheap device, I believe it's, I don't know, anywhere from $50 to $100 on Amazon.
Okay.
And you can use that device when you're having, rather than having some expensive patches that you might get from your primary care doctor, your cardiologist. Some of these devices on Amazon called a cardio device, you can your fingers on them and they'll tell you if what you're feeling is actually an abnormal rhythm or if it's still a normal rhythm. And finally, I encourage people, particularly if you have a diagnosis of hypertension, to have a blood pressure cuff at home. How else are you going to know whether or not the numbers are well controlled at home, which is actually more important than the numbers we get in the office, because it's not uncommon for patients to come to the office. They've been stuck in traffic. It's really hot out there. They're running late. They're running upstairs because they're afraid the doctor is going to cancel their appointment if they're running 5, 10, 15 minutes late. The blood pressure is going to be through the roof because, they're under an enormous amount of pressure, excuse the pun. So, we actually prefer the numbers you get at home where you relax, you're in the chill environment, no pressure. You're sitting down for about 20 minutes. Your legs are on the ground. Your arm are about the level of your heart. Everything is aligned. We actually prefer those numbers to the numbers that you might get at the office, provided you have a cuff that works like it should. So what I usually recommend to my patients is, hey, if you've got blood pressure problems, if you've got hypertension, at least one time take that blood pressure cuff to the office and match and measure it against what they're getting at the office to make sure it's accurate. That way we know the numbers you're getting at home will be.
Excellent. Excellent. Know your numbers, guys. That's the takeaway today. Know your numbers. Schedule that appointment on your birthday month. High blood pressure, cholesterol, diabetes. Know that these are risk factors for heart disease and heart attacks. The number one killer in America. Dr. Ufondu, I appreciate your time. Thank you so much. This was a great interview. Heart disease is so important to me personally because of my dad, what I've seen, and it should be important to everybody. So we really appreciate you coming through. Any last words to the audience?
Well, I just want to tell you that you got Dr. K on the pod. He's an amazing guy. He's got a great voice. I told him the other day he ought to be called the play-by-play for the Lakers. He's
all right.
But thank you so much, man.
Of course. Thank you so much. Hey, you won't get any favors by being nice to me, Dr. Ufondu. You guys, thank you for listening. Take care of yourself. Take care of your people. And if you like this episode, please like, share, comment on the podcast. Have a great day.